Hi Farmies, my next video for you is going to be on Epoetin alpha, also known as Epoetin. Epoetin is given for anemia and it increases our production of red blood cells. It's given for patients who have chronic kidney disease, HIV, or who have patients who are undergoing chemotherapy. So it stimulates the bone marrow to increase its production of red blood cells. And anytime we do this, we can be causing hypertension. So let's look at some pictures here of this. So we have Epoetin alpha. What usually happens is if you have anemia, you have low oxygen, because remember anemia is you have few red blood cells. Those red blood cells carry oxygen. So your kidneys sense that you don't have enough oxygen, and they release EPO into the bone marrow, telling the bone marrow to create more red blood cells. Okay, so that's what's supposed to happen. That's the normal cycle. If your kidneys aren't working very well, so we'll just say we've got a kidney issue here, problem with the kidney. Kidneys don't release EPO. You don't get your red blood cells, you don't get the bone marrow stimulation, and you don't get the production of red blood cells. So that's when we have to give our patients, we have to administer, let me see if I can draw this, we'll administer exogenous EPO. So we'll have to administer Epoetin alpha, because our body can't do it. So we will do that in the cases of, this is CKD. So if we have chronic kidney disease, we're not making our own, so we have to get a shot of EPO that will stimulate that red blood cell production. Other people who might need that would be patients undergoing chemo, undergoing HIV. So usually these are this is the group of people that is having a problem and that needs us to give them a shot of EPO. Alright, so what happens? What do we worry about? So if we're increasing red blood cell production, we're increasing the volume of blood, we're increasing the thickness of the blood, so we would be concerned about hypertension. And then we might be concerned about DVT. This is all because of the increase in hematocrit. So if we're increasing the hematocrit, it can result in these problems. So what do we have to monitor? We're going to be looking at labs here, right? Labs. So we're going to look at the hemoglobin. So hemoglobin, we'll just do H and H. We're going to look at the H and H for hemoglobin and hematocrit. We might also look at their RBCs. So we'll do a CBC and check their H and H. Some administration points. This is a medication. It'll come in a vial, and you don't want to shake it. So do not shake. Don't shake the vial. It will inactivate the medication. And then also we have to be concerned about our patient's iron levels as well. If we're increasing the red blood cells, we're going to need to make sure that they have enough iron. So labs. We're giving this for chronic CKD, EPO. All right, and have a great day.